Well, welcome to another episode of Mind Your Mouth. I am your host, Melissa Mugno. And as always, today we are bringing another amazing guest, a very good friend. And we were just talking about when did we first meet? I am so excited to have Dr. Kimberly Santiago on Mind Your Mouth. Welcome, Kimberly.
Thank you. Thanks for
How
having
are
me.
you doing? It's so good to see you.
Yes. Oh my gosh. Well, I'm doing quite well, actually. Very well. Despite having a minor wrist surgery yesterday,
You're doing well.
I'm doing well.
So for all the listeners, I was just telling Kimberly, I was saying to her, well, first she was asking, when did we meet? And I said, well, it's 2017. I'm pretty confident it was one of the second or third Zoggy conferences down in Kimpton. And you and I were in the back chatting it up after I did the Myo Ortho little lecture. And you're like, okay, come over here. You like to talk about appliances. And then the rest was history from there. And we've kind of just constantly always been ebbing and flowing, texting here and there. But I was saying to you is that I was just with Dr. David Alfie and myself. He was on the podcast, and I was rewatching a bunch of his episodes to prepare for his episode. And I watched yours and I was like, oh my gosh, Dr. Kimberly looks so radiant, so calm, so chill, so relaxed. And you've always been a brilliant, wonderful mind, but I was like, something is different. And obviously the surgery made me start to think. And then the next thing I told Ashley, I said, you got to get Dr. Kimberly on the podcast. I need to talk to her. I know so much has happened and changed in your life and all this beautiful stuff. If you'd be open to the listeners and just kind of walk us through a little bit of how, I know you're a CE junkie at heart, you always will be. You go to every course, but how did you get to that place? And then we'll go down, we'll talk appliances for all of our Myo people and all that stuff, but just, open up, share.
Yeah. Well, I've been an overachiever since I was in second grade, so that I can tell you. But yes, just always wanting to do the best I could. And I honestly had no idea where I'd end up. I knew I'd be an amazing doctor. I was an amazing dentist. And I had no idea I would be able to impact humanity the way that I am now doing, and saving lives, literally. And I was on a board meeting this morning for the Children's Airway First Foundation, CAF.
Yeah. Mm-hmm.
And oh my God, I have a new purpose now, which you won't even think, how many more purposes can I have in my life? But on prenatal airway and the impact if we don't get moms breathing optimally and hypoxic levels down before 16 weeks, that is where beta amyloids start to be deposited, and the breathing patterns are set. Doesn't matter about so much anatomy, but you're already, it's wild. It's wild. So anyways, that was an exciting morning. Oh yeah, I did that this morning too. What else can I do in one day?
Busy lady.
Yeah. But no, yeah, my journey started with one of my breastfeeding journeys with my second child, and struggled nursing, made it to 12 months, but the initial part was very tongue-tie written all over it. And this is 13 years ago, and nobody was even talking about that in 2012. So I just ignored it. But anyways, fast forward, my airway journey was really with infant frenectomies. I was the first infant laser frenectomy provider, at least in Seattle.
Yeah, in Seattle. Mm-hmm.
So I had watched, whatever you want to call it, with Bobby Gahary in Portland, and then shadowed a naturopath for just a couple days. And then I'm like, all right, ready to go. So that was in early 16. And then back then there wasn't a whole lot of talk about airway, but there was a correlation. I'm pretty sure it's probably the Christian Guilleminault paper on short frenum phenotype for pediatric sleep apnea. So I was like, well, how does this all work? So then it just kept going. So I studied with Barry Raphael. I did the Airway mini residency. I've been to Zoggy now 4 times, and just all over the place. So I never thought I would actually do expansion in architecture. I was happy just in my little tongue-tie world, and then that's not enough, never enough. And so I was like, I'm going to do this. I can do it. And to do it well and to do it comprehensively is a lot of work. And I was just talking with, do you know Dr. Joseph Yousefian? Do you know the name?
Yeah. I don't know. I mean, I know of him. I've come cross paths. We haven't met. Like we haven't like in depth anyway.
Yeah. I just befriended them, and well, anyways, good stuff coming down the pike for some teaching opportunities for me, but they're lovely. But my point though is it is so
You know
debilitating.
what? Why don't you tell listeners exactly who they are? What would that
Oh,
whole area?
absolutely.
Yeah.
So Dr. Joseph Yousefian, he is a board certified orthodontist, and he was talking and doing Airway at least 20 years ago.
And he's
So
located.
he's in Bellevue, Washington. So he's
Yep.
literally in the town next to me. And we crossed paths ever just so briefly, a couple patients over the years. And I don't know. I don't know. I never reached out. It was just, I wasn't learning about it yet. I didn't know, but I was like, this is weird. Why is this man doing sleep studies and doing ortho? And I didn't put it all together, obviously, back 20 years ago. So, but I was at a CAF meeting when Sharon Moore was visiting to help build what CAF is doing. And they were there, Dr. Yousefian and his son Ryan. And so that was actually our first face-to-face hello. And that was in March. And I just reached out and I was like, let's hang out. And so we all just hit it off. Like it was
Meant to be.
Yeah, they had me pegged into a very specific type of treatment. But once they learned and looked at I call it my educational pedigree, like the nonstop all over the spectrum of learning, they really want to partner up together on ideas and teaching and stuff. So,
And that's just so people know, so just so that we kind of stay in the same place. It's just that, so right, you've always had AirSync. You have a very amazing practice,
yep.
a practice that does very, very comprehensive airway treatment plans. There's no joke. Sarah and I have talked nonstop. When we get a report from you, it's like no other. The level of understanding and education that these parents and patients have is incredible. I mean, your comprehensive evaluation could be a CE course on its own. And it really is. And the fact that you know, and I'm sure your staff, I mean, I hear you've talked about your staff numerous times, but because of your ability and how much you pay attention to detail, even the visual aspects on your report, right? Like on the PDF and the PowerPoint that your patients get really does not leave any questions. So if a patient walks away, they can really go back to that and see exactly why, how, and when.
Exactly.
And not a lot of people treatment plan to that level. And that's one of our biggest issues, obviously, in Airway, which is where we get, and I get the most questions and the most things, is that especially from the myo community, and I know you talk openly about it, we have all these doctors that are still very resistant. I do agree with Dr. Alfie that we have come a long way, but it does sometimes feel like we took a couple steps back. Every year it's like, okay, we did great. Now, I don't know. Now this organization's saying that, which resistant is part of growth. And so I try to, keep my mind on that. But the way you treatment plan, the way you do things is really like no other. And I'm excited for the listeners to kind of get into your head a little bit, because not only are you practicing like this, you've literally been an active participant and patient of yourself. I mean, there's nothing that you aren't recommending to somebody beside that you haven't done, and you're even open, right? Discipline is tricky to do your myo and do all your things.
Yes.
But ultimately, when it comes to structure, there's not really many things that you haven't tried and haven't done, and also took the course on it. So,
Exactly.
Right? Am I correct on that?
You're pretty much there. Yep. I haven't learned to do jaw surgery yet, but we're not going to go there.
Okay, maybe, yeah. So now you don't do your own jaw. I mean, you don't need to do your own. That's good.
No, yeah.
But I've heard you say, you didn't think ortho was going to be something that you even really were going to get into. But to be honest, in this world, you had no choice but to do it yourself. Correct. Nobody was going to do it the way it needed to be done.
Absolutely. And interestingly, I mean, I would love in a perfect world to be placing the MARPEs, doing the early expansion, development, alignment, and then forming an alliance with the orthodontists where I could be placing the MARPEs, I can be helping with the treatment planning, and then I would have orthodontists that could do non-retractive ortho because it is hard. Like post MARPE ortho is hard.
What makes it hard?
Yeah, so we're opening up space, correct? And not just transverse. And so a lot of people don't realize, or maybe they have if they've listened to me talk, but you can protract the maxilla. So I have translated in an adult male, multiple adult males, the maxilla forward up to a centimeter with extremely diligent face mask wear. And I'm now placing my own bollard plates. Do you know what those are?
No, tell us.
So they're plates that go, I place them right between the lateral and the canine. So I make little incisions. Everything's
corticizing technique a little bit, or
no, you don't need to do any corticotomies. It's literally a plate that is screwed to the bone, and then there's
which you're making by 3D printing, correct?
Yep. So partners overlay. It's just like how we make our custom MARPEs.
Okay.
So there's a guide. I know where to make my incision, and then it's like I love surgery. I absolutely love surgery. So, yep. So the bollard plate allows. So there's a hook that comes out right in front of the canine. So you have the patient wearing elastics, class 3 elastics, all day long, and then at night or as much time during the evening or day that they can throw in, then wear the face mask. That way, they're getting constant low grade force and tension on the maxilla. So I placed my first set of plates a couple weeks ago. It was wild.
And everything, one thing I've been talking about a lot is that, what's going on with AI technology. I mean, I think anybody who's not getting ahead of this and not getting into it, they will be left behind in the next 5-10 years. It's just inevitable, probably sooner than that. I'm just trying to be kind.
Yeah.
But nowadays with 3D printing and imaging, what you guys can do is, and I love my analogies. I don't know if you've ever listened on My Own Mentor, but I would say at this point in time, if your expander doesn't fit like Spanx, I don't like, then I'm like, that's not a real expander anymore, right? Like you can do better.
I know. Absolutely.
And do you think that's even something, the 3D printing and stuff, like even on kids, like, right? They should be done even there, right? Like it should be flush up against that palate.
Yes. So my bands are all 3D printed. I don't place separators, although it does get a little hairy sometimes with pedo, with all primary dentition because there's no undercuts. So it's been not too terrible, but like the expanders will debond.
Debond because they don't have as much grip, something to hold on to as much. There's just, so they'll pop off a little bit.
Yep. Yeah. And it thank God does not happen that often, but it always happens on the 3-year-olds. That
Yeah. If it's gonna happen, it's gonna happen on the patient that's the most wiggly and the most, all those aspects. But that has ultimately really changed so much. And so nowadays when I'm walking into these, now it's like, okay, you convince somebody to do early expansion and then you see the type of expander you're using and you're like, oh my God, that looks like an iPhone 2. You know what I mean? Like it looks like they're on these old school things. And, now I feel like I have to tell parents, you need to ask the orthodontist what kind of lab they're using.
I know.
Right?
I don't even want to comment terribly because I never like to speak poorly, but some of the things I see, there's not that many airway focused orthodontists, and those that purport to be so. Anyways, I don't want to go.
No, but how about this? Let's go there in a mindful manner, right? The 2017 Melissa and Kim maybe might have said something different, but 2000, what year is it? 2025. Thank you, 25. It is more about where your mind goes, your energy flows.
Yes.
And I just feel like that let's just talk a little bit about airway orthodontics and airway practices. This is a word that is used a lot, and we talk about it in all different ways. But when I think of the philosophy or the mindset that the practice needs to have to be airway focused, what would you say what would be the elevator pitch for a true theological or, ideology of what an airway practice is.
So not even talking about orthodontist. We're just talking about
Let's just say, just airway.
So you have to believe that there's more to just airway than structure. Structure is one component, hard and soft tissue, but we have neurology, we have oral function, we have posture, so upper cervical alignment, along with the arrangement or the symmetry or asymmetry of the cranial bones and the tension it puts on all the cranial nerves that come out of the base, which is a whole nother amazing discussion on how that leads to oral dysfunction and breathing disordered sleep.
Posturing is everyone that's listening, and if they're following me, they hear me talk. The last year and a half, we have changed every protocol possible because I don't know, Kimberly, if you knew, like I developed a new Munchie protocols for Dr. Mary Burke. I spent a year and a half developing their new DDP, their dental discovery program. Ooh. And together Dr. Mary and myself worked with multiple offices that I was doing consulting build outs on of how we could activate these phases, like activate using chewing to kind of highlight dysfunction.
Yep.
And I couldn't believe how much quicker, how much better things moved, how much just overall compliance, all these things we figured out when we started to throw a beanbag on kids' heads when they were clicking their tongue or when they were chewing. So if you popped a munchie in and opened the vertical, the bite, ever so slightly, and put a little beanbag on their head and you practice that for 4 weeks, I couldn't believe that how much better the expansion went or how much better, because we started to unlock. And then Dr. Mary given us a lot of cool exercises to add into for posturing, balance, just activating, people love to call them primitive reflex exercises, but I always say they just highlighted the primitive reflexes that weren't developed, right? We're not OT, I don't do primitive reflex work. I'm not an OT, but a good myofunctional therapist can highlight the dysfunction and really, quarterback where you need to go. And from a myofunctional therapist that loves appliances, my goal is always to try to help you guys unlock the structure and and release the cranial bones. And man, what we can do if we put some activation was really blown away. And I don't think you and I even knew to talk. I didn't even know to talk about that in 2017, right? Like,
oh God, no. So I just took Mariano Rocabato's course this past year. Was it this? Oh my God, I can't keep it straight. And I did Bob Walker Chirodontics. He doesn't call it that anymore. He's a chiropractor. I feel like he's got a nutrition license in there too.
Okay.
But I literally learned how to manipulate the cranium. I'm not going to do it because I don't want to go to jail, but
but understanding the how doesn't mean you have to do it.
Right. But I can identify the strain patterns. I can see what I need done for the temporal bone rotations and the maxilla needing to be leveled. And I can work with colleagues that can
help with all that. So but how important is it? It's multifaceted, right? Like you can't really do the work you're trying to do if you can't rotate the bone, right? If the bones aren't willing to unlock and unravel.
Yep. Yeah. It's
talk about that with like, if you can't unravel, is that why all of these appliances don't work, Dr. Kimberly?
I would say so. I would say that's why we get asymmetric expansion. I would say that's why the controversial AGA, which I did many of, and I was very successful, never pushing teeth out of the bone. And I know, I don't want to go down.
Okay. Listen, we're all about, here's the thing here. Everyone knows there's like a little disclosure. I mean, if you're listening to me and you get offended, you shouldn't listen. You should probably go somewhere else, because the goal is to talk about uncomfortable have uncomfortable conversations so that we can learn from them. Like I'm just not a fan of people that just dismiss things and say no, because you and I had sat and talked. I think Zagi and Kevin at one point were talking about me doing AGA. And then it was like, hold off, let's just figure this out. We didn't know what we didn't know. Right. And at the time, AGA's logical for our world, right?
We need
tongue forward, push everything forward, light force, and use all the right things. So it's not the wrong theology, right?
But it's you have to have the right diagnoses though.
Okay. Yeah.
So you have to look at the skull three-dimensionally. And that's what's really challenging with appliances is sometimes you need two, or you need to know how much anterior development you need. So how much sagittal, how much transverse, and do we need to change the vertical? So that's
Mm.
where I never finished the ortho part. Was that when you start manipulating the maxilla in 3 dimensions and you're opening up all this space, you have to learn different mechanics for moving the teeth so that you don't retract, and you have to either leave spaces in particular places, or we build all these crazy, crazy features into the MARPE so that we can mesialize or distalize or intrude. It's
So
wild.
what you're saying though is in the MARPE, you are planning for possible things that might not go the way you want, and then you're actually adding the ability for you to control it.
Yes, but I treatment plan all the dimensions initially. So I've already built, I know I'm going to intrude the posterior segments. I'm going to protract. When you intrude the posterior, the mandible has no other choice than to auto rotate forward because it won't have any occlusion. So I'm already building all these things in, and then aligners don't always do what they're supposed to do in these cases. So whatever the brand, Candid, Spark, whatever you're using, it doesn't matter. It's just a different level. Like it doesn't track the same way. So just moving teeth simply like what Invisalign or any of those aligner companies, they
Clear aligner companies. Mm-hmm.
yeah, it's just a different animal with a MARPE. Or if you're doing surgically assisted or surgically facilitated, it doesn't always
Go
go
the
the
way
same.
you want it. It doesn't
No,
always go the same way. But
no.
with technology and 3D printing, you guys are able to control the uncontrollable things sometimes
As
now,
yep.
as much as way more than you could.
Yes. Well, getting out of the MSC was like the best thing ever. The MSC was like the devil.
Okay. So let's talk about why would, and again, I want to, like, we want to know, like,
yeah.
from not only a doctor standpoint, but a patient standpoint, what was it?
So with the MSE, so maxillary skeletal expander, that was basically the first prototype, if you will, by Juan Moon developed it.
Yep.
And it's the proprietary brand. And it came in 3 sizes, 8, 10, 12 millimeter, I believe. And then you had 4 TADs. So it was stock and you had to place the TAD. It was already fixed. So you could move it forward or backwards in the palate along the suture. But it was not customizable, and the arms were flexible. And so when I started placing MARPE or MSEs, MARPEs, I was not doing nobody was talking about corticopunctures yet.
Yeah.
So we weren't getting suture opening, and we were getting considerable flaring of the molars because of that flexible.
Interesting, just a little side note. So Dr. Juan Moon, for any of you guys know, he was the director of UCLA orthodontic department. I actually had dinner with him and was invited to UCLA when he was still there. And I don't remember, this was probably 2015, 2014. And I remember going in there and, anyone that doesn't like UCLA is a very sought out orthodontic residency. I think it's a paid residency, if I'm correct. And so brilliant minds were there, and there was like crazy traumas and all this stuff. And he walks us upstairs. I was actually with one of the doctors from MyoBrace at the time. And I remember he's showing a skull. We're in his little office and he's showing some of these cases, his first mark. And there I am in the back, like as if I'm such who I thought I was. I was like, well, you know why that case isn't staying? Like, it doesn't look any better now. 2 years later, the tongue is low. Like, you're not. And he like looked over at me and he's like, do you think I invited you here because I like, like he just kind of looked at me like, obviously I'm here to have this. He was very fun guy, very nice. And we went to dinner and he made a comment and he said something to me and to the one other person there. And he said, this is going to be an uphill battle, what you guys are doing. And he goes, and it will truly be a testament of who is willing, in a sense, to ride it out the longest, because it will take very particular types of personalities and people to be able to continue the pursuit, because people will say, we were talking about money and all these ideas. And he says, listen, he goes, you have to get the 1% of people to buy into this, because those are the ones that eventually will spend the money so the research can be done, so it can be developed, so then it can go. So eventually in 20 years, you can create a better, repeatable, scalable process. And he used the example of fashion, which I know you have exquisite taste. Dr. Kimberly Santiago has some of the best pieces. Just a little tidbit for any
They're
of the
investments, truly.
they are investments. I am saying you're exquisite. When I say this is value. Like when she was in LA, she'd run out at lunch, come back, and I'd be like, "What's in that bag?" But
that was a one-off.
But he said, oh, sorry. But he actually said, he goes, I was carrying some non-designer bag, not making very much money. No, and he said to me, he goes, that bag is a knockoff. And I remember being like mortified. And he said, don't be. He says, it took the 1% to buy over and over again that design so that eventually somebody could buy it, design it, repeat it, so that more people could carry it. He goes, and I'm only saying that to make a point for this dinner. And he goes, and I have a wife that, loves that, we were back and forth. And I didn't really understand the power of what he was saying at that moment until probably the last 2 years. And, whether or not his design or whatever was perfect, he really was an absolute pioneer in moving and creating this concept. And I think back to sitting there and sitting with you in 2017 and 18 and where we are today within our own community.
Yeah.
And we are way more systematic, and we do have better. I mean, we need to get everybody else on board, but we are better.
Oh yeah. Well,
right? Like we know so much more.
Well, we are all, but you and I and Sarah and Audrey and Tracy, we're the pioneers, and we keep pushing the needle, and we're not happy if we're not evolving every day.
Same. I mean, even, I know you were just, I think, where were you guys in Switzerland? Where were you? Switzerland? You were just in
Vienna.
In Vienna. And, we're heading over there in January to do another big conference. And, listen, Renata came on after Sarah and I actually think she took a couple of the classes. And what Renata has been able to do with social media and being able to create has moved the needle in a different way, right? The access to information has created things to be more scalable and process. Yeah. And so I am so much in the space of anybody who can bring their area of expertise or their niche or what they're great at, and we're all on that same page, is what will continue to grow, because we're not going to win this with arguing with orthodontists. I mean, it's just not gonna, we're going to do it by consumer demand, right? By moving that. And I feel like always knew that you had to treat your patients and educate them on a level like no other. And I don't think you really ever took no as an answer from other doctors. You just figured it out.
Yeah, exactly. And it takes time to really build an airway practice. And
we had those conversations.
Yes, I know. I'm still working on myself because I don't want to overwhelm.
But no. I didn't even mean that. I meant the time, from the consulting side of things, the business of Airway, right? We've redid a rebrand for the consulting, right? So Mind Your Mouth, the podcast, and I've developed these new things, and it's mind your business, mind your mind, mind your mouth, and mind your body. Yeah. And it fits very well into everything because the business is a big aspect. And what I was talking about was a conversation you and I had one time about, there's always more we can add. When do you know, what's the patience? Where's the discipline of going, okay, do I invest in another course, or do I invest in this, or do I invest in more staff, or do I invest in a build out? It can become decision fatigue.
Yep.
And that's a lot for not a doctor, but a business owner in general.
Yeah.
And I don't think dentists, and especially airway focused dentists, get enough credit for having to do all four of those. They have to mind all these things and still be able to pay the bills, do regular, right? There's a lot to it. So on a personal level, you have had to be consistent and push through, right? I mean, I know you have a lot there, even just the practice as a whole, right? I mean, I think I heard on Alfie's podcast, what did you bought your own practice, 4 months out of school?
Yep. Yeah. I'm not shy to buying things. I had already lined up the purchase before graduating.
No, you know what? We're going to say this about the money. You're not afraid to invest in your future. You're not afraid to take a little risk. And I don't mean to talk for you. I'm sorry. I just want to
No,
give you that
please.
credit.
You're good.
I want to give you that credit because I don't look at like, most doctors that I do, I'm so grateful that I get to do the consult, that I get to do the build outs because I think that's what will help move the needle. But there is a big like restriction or fear is probably the right word, of spending, investing in the unknown, right? They're scared. And I actually think that's an area that you, maybe because of your eye of detail, seeing the future a little bit, trusting your gut. So yeah, I mean, is that something you've always, even since you were a little girl, like, have you always kind of had a good gut instinct in some stuff?
I feel like it, and I do believe, for better or worse, things happen for a reason, of course.
Of course.
But yeah, no, I mean, none of my classmates bought a practice within months of getting their license, and I was a COIS graduate. I realized really early on, like a year into private practice, that I had no idea what was going on. I didn't understand occlusion. I didn't understand comprehensive treatment planning, and thank God I'm like 20 minutes from the COIS center. So that was kind of my first addiction, finishing that whole continuum within like less than 2 years. And that just, once you start surrounding yourself by providers like COIS doctors, you just keep getting lifted and lifted and lifted. And it's mostly general providers that are offering such high level care. So you start learning and you start taking more risks. Like I started doing implants back in 2009. I bought a cone beam in 2009. I was pregnant with my first, and I'm like, I am never placing an implant without a cone beam. Nope, I am not. I refuse. And everyone thought I was crazy. And I was like, I feel good. I know it's going in the bone. I know I can get a screw retain, restoration on there. And then I started doing everything guided. So I'm always adopting technology and doing things in a very secure and predictable way. Which,
yeah, you weren't afraid to kind of advance and do the technology and move things in the right position. So being able to always kind of jump in and adapt pretty early has not been something you've been scared of, which is huge.
no, yeah.
So I know the tongue ties was really where you started to go out, but just to kind of come back to the expanders for a minute,
Mm-hmm.
tell me a little bit. So what was the first appliance you put in your mouth?
In my own mouth?
In your own mouth?
What did I do? I tried, well, this was before Airway. I tried a mandibular advancement appliance. Okay. And I don't know, well, I couldn't tolerate it. Like my joints hurt, the vertical, everything was just not right. It was not good.
So let's go that. So, okay, you mandibular advancement, anyone doesn't know, takes the lower jaw, moves it forward. Open. When we're saying vertical of the bite, we mean we're opening our teeth a little bit just to give us some space, which allows the tongue to move, allows a soft palate. It makes you feel like you can breathe easier.
So it's prescribed. So if you have a diagnosis of sleep apnea, I had mine made. I think I was at a class with Dr. Rouse, with Jeff Rouse back before Jeff was a household name.
Household name, yeah.
Oh, there we go. I was an early adopter with Jeff Rouse.
Yeah, Jeff. Some people will also recommend mandibular advancements for like severe clenchers and grinders, right? Even without that diagnosis.
I mean, anyone can buy it. If you want it covered by medical, you need to have the diagnosis and the prescription.
But, see, I've been fee to service my for so long, even when I was introduced. I don't think I am. But you're right. We do need, it's important to know. So if you have a sleep apnea.
Although, interestingly, after this morning's meeting with CAF, my brain, of course, started to, I already have like a business plan that I've already written out on a platform for prenatal, like how I'm going to screen moms so that we can get them into a mandibular advancement appliance without the need for insurance, but through Snore Lab and a sleep image test. And we can then say, okay, but my point, so you can use it. Yes.
So hold on. No. Okay. Let's talk that out a little bit. Let's be a little more methodical. So,
there's more to it then, but yes.
Okay. So, but we're talking about mamas that are postpartum. What are we talking about?
This is the prenatal part. So
prenatal. Okay. Sorry. So before
or post, I mean, it can be, but the key to helping truly prevent This is where the research is going to be.
Where the research is. And this is, okay, so the listeners, so you guys know, okay, there is a lot of great new research coming out showing that, like all great moms, we mess up our kids in utero. We do. And when you are in any stress as a female, when you are pregnant, and stress can be anything. So not sleeping well is a stress to the body. Your environmental stress, your relationship stress, any type of stress, pelvic floor. Yeah. Any stress.
Yeah.
The womb, because our gut has brain, our bodies hold the score, we are transferring some of that to the children in utero. And because of that, the problem is actually, to be honest, and I think Kevin Boyd is saying this, that even when the baby comes out of the womb, they're already slightly geriatric. Like the problem's been going on the entire time that it's happening. So, which I can 100% validate this. Obviously not research, but my personal experience is my own research, and that's what I go by. Jackson is, so 2017, that's actually, you met me right after I had him, probably at the peak of the worst I had ever been in my entire life. My children are 7 years apart. JJ, bonus baby, a lot of stressors, wasn't planning on having another child. I was 36. I was severely clenching, grinding. I was taking, I was on Lexapro before I got pregnant. I was on Adderall, traveling nonstop for work, no sleep hygiene, but yet preaching it, and really struggling with anxiety and depression on a level and trying to mask it and suppress it every which way I could. Thank gosh, I was always confident about what I was teaching and I was passionate about it. I just couldn't adapt it. And Jackson, I had to come off of obviously all the pills, except they sent me to high risk and they told me to stay on the Lexapro while I was pregnant. And I knew it was probably the most tormented decision of my life. Because I knew what I was doing, but I physically couldn't come off of it because the stressors were even worse than the current stressors.
Just the
yep, exactly. And the amount of weight I gained in that pregnancy was obscene. I was inflamed, and everything about that pregnancy was really challenging, even though that maybe in life I appeared to be okay. And when I had him, the best joy I've ever had. I'm so grateful. Everything happens the way it's supposed to. And he was, he was good. He tongue tie, all the things. Right away, you could see the lower jaw working harder. I struggled to breastfeed. I mean, the whole thing. And I literally learned and adapt with him. And me and him, we make a joke that, we've been on this journey together.
Yeah.
And when I really recognized my own and really took my own health and my own body and my mental health into my own hands, is when I really could see that he was mirroring me. Everything I was struggling with internal he was struggling for external.
Yeah.
And it was there as a child. And I know that's what happened with me and my mother. And, it was cycle. And with that, then I saw it in his body, which I'm so grateful that I've been able, I think, to claim my own health so that I could, break these generational cycles so he could see something different. And I just don't think, Kimberly, you and I can talk about this, and there's going to be parents and there's going to be people that listen to this and they're going to resonate with it, but they're going to turn the podcast off because it's going to feel overwhelming. And it's going to feel like a lot because a lot of us are in survival mode. And that's the area where I just constantly want to tell them that they don't have to stay like that.
No.
And yeah, what you're doing in this early, give us some ideas. Where is the research going? When you're talking about this?
So there's, I think, oh goodness, there were two PhDs. They're doing research on pregnant women. That sounds terrible, but identifying if they have upper airway resistance and hypoxia. I didn't get the whole entire
idea though, the getting them more air. We can even be a little bit more basic. You don't have to go to they're going to get them more air.
Move the mandible forward, jaw forward with an appliance, which looks like two night guards attached to each other and pulling the tongue and the mandible forward, and then getting them to nasally breathe. And so those two acts lowered the oxidative stress. So when you're in sympathetic tone, which is what you were just saying, fight or flight, chronic stress, the body goes into, internally, it's a storm of hormones and stressors to the developing fetus. So if mom's under stress, baby's under stress, and that changes the breathing patterns. And we were talking a little bit, I think maybe right before we went on or once we started, but brain damage is already happening to the baby. Beta amyloids, which are the deposits, it's normal to form beta amyloid, but that's what leads to plaques and tangles, which are it's the brain matter that you find in dementia patients. So you start to see buildup of beta amyloid in these fetuses, interestingly. So really what we're trying to do, or this is my new mission, or it will be, is how do we protect those brains in the first trimester? Because the brain's really developing by 16 weeks. So if we don't optimize mom before 16 weeks, we're going to be behind. And then when it comes to posture, interestingly, so from my education with Rockabato, if mom's hips, if we have descending problems, hips are not aligned, or we've got
pelvic floor issues,
baby's going to not be in an optimal position, and you're going to already create fascial and cranial strains. And thus they see an osteopath, which should really be the first stop after the pediatrician's giving you all the thumbs up. But
for infants you're talking about, but they're even prenatal. You could be doing the moms should be doing so much body work. And
absolutely. Sorry. Yeah.
But I mean, there's a lot of like work that can even be done, prenatal. And, you hear us say the word dementia and then you hear kids. And this is something I know, Dr. Kevin's talking a ton about.
Yep.
And I'm very open about everything. I have been struggling very severely with my memory, my short-term memory, like forgetting people's names, forgetting simple words. And I'm owning it. There's nothing I can do about it. I've been working with multiple different things. The last 4 years I've been off of, I came off of all the pills. I haven't taken anything in 4 years. I haven't touched a sip of alcohol. I've used, just because I couldn't maintain and decrease the inflammation with it. And, I've chose to go down and work with psychedelics to clear my mind, to eliminate some of the stressors, because I needed to rewire the brain to get work with it. And I've made a lot of progress. I think I've definitely delayed the memory because it was getting really rapid. And that's what's leading me more into the conversation of whether we do jaw surgery or the structural stuff. Yep. Was I know that the only way to decrease this is to slow down, to get more oxygen. Mm-hmm. But it goes back to when I was in school, I couldn't retain what I was reading. I would read something and forget. I was having memory and retention issues very early on. Thank gosh, in a way, maybe, I don't know if it's good or bad. I was born in 81. So the Ritalin thing didn't start to 88. My mom I didn't get on it until after high school, which I think for me, thank God, because I do think it would have really sent me into a different spiral, being on all of that so young. Mm-hmm. But the retention issues were no joke. I couldn't remember anything in school, hence why I struggled, and then started to believe I was not smart and, all of these other aspects, and imposter syndrome and all these other, as it unfolds. Yeah. Because those are really fundamental times in a child's life, and you put them on all these pills, or you label them and all these things. You are packaging and creating an adult with a lot of issues.
Correct. And telling them they have issues, or maybe it's very interesting. My daughter, with what's gone on in our lives for the last few years, she's been struggling quite a bit, and she had to go into an acute therapeutic residential program. Sorry, I was trying to remember the name. And they diagnosed her with every possible DSM-5. I don't even know what it's anymore. And long story, now I'm trying to unwind it and help her deal with her grief and her anxiety, and started going to the naturopathic side of medicine. And I just got through all this neuropsych testing, and her only real diagnoses are ADHD and anxiety, depression, post,
Her, her,
PTSD. And
yeah,
yeah,
having a major trauma of any time in your life at any young age is going to create severe PTSD. And, I
oh,
have come to this place about ADD and ADHD, knowing both of her parents for, in a time like she's, she's in her ancestors are brilliant and with brilliant minds and lots of thoughts. There's a lot of things probably going on in her
yeah,
beautiful mind,
yeah.
and it's all over the place. And unfortunately, I guess I should say fortunately and unfortunately, because there's never, with every dark, there's light.
Mhm.
And I really do believe that. And I understand leaving people out as I felt alone and that I was weird or I was afraid I was broken. I reverted to behaviors that were not healthy.
Mhm.
Lying about things, hiding things because I was scared to let people know what was really going on. I know that's not healthy. And I'm very grateful for the openness of conversation and recognizing that mental health or, that people are struggling and that you should have a safe place to talk about it.
Absolutely.
And you should be allowed to process and grow with it. But anything in extreme, if it's not right in moderation, and then to then say that this is who you are and this is always who you're going to be is the extreme. It's the opposite. It's the other side of the side of saying, keep it quiet and
Mhm.
hide it and don't own it. Right. Like it's black or white. And I don't think that's true. It's like sleep apnea, right? You start with audible breathing, you're snoring, da, 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 da,
Yeah.
and then you end up all the way over here. It's a pendulum, and this beautiful body of ours is so connective. We see all of these aspects, and life is not easy.
Mm-mm.
Technology and where it's at and things, I think, highlights all of these things for us, and it makes it. I mean, being human is a really big job right now.
It's yeah, our species isn't doing well is what I always
Yeah,
say.
it is. And it's
It's hard.
easy to offend people. It's upset, and again, and I'm not telling anyone's wrong for their feelings. I'm the biggest a component of big feelings. I think you and I can I have lots of big feelings, but I'm also a really big component of trying to get to the root cause.
Absolutely.
Right? And I think that's where, going back to that question of what is airway dentistry and what's the theology, I almost want to say,
Yeah.
do you, can we almost break it down that simple as like it's not just band-aiding things.
No, no. And the root cause is so multifaceted. And what I tell patients, the easy thing to do is structure, right? And
Yes,
the
structure is
easiest thing,
it's billable, it's seeable, it's touchable.
and
It
we do
hits
it
all
for
the
you.
senses.
I
Yeah.
mean, the appliance and the doctor, we're doing it with you for you. I feel like the functional part, I don't want to call it easy by any means. I think it's hard because I can't even do it myself, but it requires commitment. But even deeper is the unwinding of trauma, the nutritional deficiencies that we have. There's so many comorbidities and so many layers. And so I wholeheartedly want to get to the root cause, and I can get to some of it, but not all of it, of course. But
But
that's
you
where
are,
it's
yeah, you're doing a lot more. It sounds like the work and where you're really leaning is you guys are doing a lot more with better screenings, better options early on, right? Is that what I'm
yep,
kind of hearing with what
yep.
you guys are doing?
Well, I'm still like my passion is still infants and getting to the kiddos as early as we can.
Mm-hmm.
I seem to attract a lot of adults. So I'm getting the other side of the spectrum, but
It's interesting you bring up with the adults because that's absolutely where I've landed. Like that's
Mhm.
probably my specialty, right? Especially with the mental health aspect. I mean, if you're going to do myo with me, it's going to be an experience, right? We're going to activate the mind. We're going to figure out where these root causes are. I'm going to get you so uncomfortable. I'm actually in my consent form now, you have to consent that you're going to be like that you will not get upset or offended and I will make you cry. Actually, if you don't cry, then we're not releasing anything. We're not releasing the tensions that you're holding.
Mhm.
And I'm not that's not for everybody, but what I think we have the ability, like right there, some of us have to own the adults because the adults have the power to change the next generation. And I think we do all focus on the kiddos, and we all need to focus on the kiddos without a doubt. But I feel like there has to be a militia, like there has to be groups of us that are tackling and honoring all the different ages.
Absolutely.
Right. And there's not many people that can handle the adults. And that's probably why you're getting them, right? Because there's not many of you that will sit and have a true, deep conversation and go through it. And I think back to our I almost want to apologize to you now. I think back to the one conversation when I told you, can you not go so deep? And it was because I didn't, but now I realize you were telling the patients exactly what they needed to hear, and they just weren't ready to hear it. Yeah. And the truth is, me telling you to, or, any of us being like, can you soften it or simplify it, was us not doing, the complete service that we needed to. It's actually no better than what some of our colleagues that we might disagree with. It's meeting the sales aspect of it. And I'm not here saying it's bad or good, but it is part of it. And I think it's important for us to say things like that, to be like, hey, thank you for not, shortcutting, for not just giving the patient what they wanted.
Well, and I think for me, because I'm a work in progress, I'm still struggling with case closures because it's so comprehensive. But I think I need to be able to give the patient the full set of diagnoses, but like they can chip away at the treatment plan. So I'm trying. They're my patients. They're not my children. And I try, I can only
great line. Great line.
Lead them to the water. They have to drink it. So
yeah, you got to get them. It's a story. You got to tell a story. You got to get them to feel it, identify it, see it, and then get committed to it. It's human. It's human behavior. It's not easy to change.
And there's years and years of undoing when you get an adult.
And you're gonna make them uncomfortable. You're gonna offend them. They're gonna not like it. They're going to want to argue. They're going to want to retract. They're going to want to push away. They're going to say, no. And what do most people want to do when they're uncomfortable? They want to blame someone. It's not working. It's not, this isn't what I wanted. Yes. You told me this was going to happen, not own some of it.
Well, and I think so for me, let's circle back to the question, like an airway practice. So I think I'm seeing a lot more pediatric airway practices, or pediatrics. It says pediatric and airway. So they're, at least, thank goodness, I'm seeing the word airway showing up in the names of some pediatric practices. But the level of assessment, and I've developed my way. So everybody gets a cone beam. Everybody gets a sleep screening. Literally, I want to see their physiology. I don't do a full myofunctional workup, but I do a functional workup. I do a neurologic reflex assessment. I'm doing craniofacial. I'm doing all sorts of pretty in-depth things. But when I get patients that want to go get second opinions and they don't even recommend a sleep, this is an airway provider, and they want to put them into a preformed appliance. That's all they need. And I'm like, no, I don't know. I'm appreciating that there are more people, but it's all over the place, I guess is.
Okay, so when you say it's all over the place, people are going to come back and be like, well, what does she mean it's all over the place? So when you say it's all over the place, it's like, and I know you don't want to say certain things. There's just, tell me.
I know who.
you're playing good PR. You're playing politically correct, and I appreciate it. But at the same time, I think what I know, and you and I think would agree on this. It's patient selection. It's understanding what you hope the outcome will be. And yes, there's a lot of similarities. There's consistencies in a lot of people's OMDs. And when I say OMDs, I mean oral myofunctional disorders. But you can't just slap an expander on it. You can't just slap a prefabricated appliance in it. That doesn't mean that those appliances can't be helpful
right
at the right time. But I used an example the other day. I said prefabricated appliances or myo, or the way we treat and plant, it's like salt and pepper. every treatment plan can use it, need it. It will highlight things. It will bring flavor to life, but you can destroy a dish with too much of something,
Yep.
right? And it takes a really good eye and a great chef and a good person to know what they're trying to develop and what kind of presentation and plan they're trying to make. And then that's how they're executing. And that's the power when I think of great airway dentists or great pioneers is like, we got to give you patience. We got to give you the trust that you're going to navigate things. And sometimes you got to tweak the dish. Sometimes you added this in it and you went, oh, whoa, I didn't expect that flavor to go that way. Right. And that's part of practicing medicine.
Absolutely. And for me, what I've always prided myself on is architecting or strategically planning the case. So when do we involve the ENT? I want it strategic so that the patient sees the whole picture.
Mm-hmm.
And there's certain times where you do certain things because, you send to the ENT, and I love ENTs. You can't live without them, but they do subtractive procedures, right? So they're not making the nasal volume bigger per se. They're taking contents out to make it seemingly bigger, but overall the dimension's not correct. So if we're talking about the nose, if we're talking about tonsils and adenoids, I always give patients unless they're grade 4s. If they're grade 3, 4, I'm like surgery. But if they're willing to commit to, we're doing oxidative. I hung out with Renata a couple weeks ago. She had no idea all of the crazy stuff I do in my practice, and I haven't even
she didn't. I'm like, I love all that stuff.
oxidative therapy. Do you know about all my new technologies that I bought?
So I kind of was reading. I went up on a couple things, but no, please tell us all the new things that you're doing.
Let me come back. Sorry, I can talk. We should do part 2, 3, 4, 5 because we still
keep going.
Finished the first part. So I try to give parents the option to not do surgical intervention for tonsils and adenoids unless I'm like, that sleep study is scaring the poop out of me and the neurocognitive damage to your child's brain, you have to go to the surgeon. But if they are going to follow my recommendations, we're going to do oxidative therapy. We're going to get them into expansion ASAP. We're going to start on the myo. We're doing intake strips now, which are the magnetic, better than breathe, right? We're doing those on kids. We're doing.
So they're great.
You have to do, you can't just put an expander in. Like there's more that needs to be done. But I like giving parents the choice because I would have wanted, and thankfully my kids didn't need tonsils and adenoids removed, but I would have wanted the choice. So
and when you mean choice, you mean the choice of trying to do natural nasal hygiene programs to really get the nasal patency up so that we can increase air volume naturally
and get nitric oxide.
And try to get nitric oxide flowing. Because we do know that if you can get consistent, and we're talking consistent like 60, 90 days, not 1 week, not 5 days of consistency, you can see lymphatic tissue, tonsils and adenoids and different tissues decrease in size. Correct.
Yeah.
Right. You can see that naturally go into it. And then are you saying that? But if that can't be achieved, then at least you know that if you have to take tonsils and adenoids out, you've actually tried everything you could on a natural, more homeopathic side.
Yep. But if the sleep data, so that's the critical part, is having sleep data.
Okay.
They're hypoxic. That's brain damage. So I don't want to say brain damage to parents. I say neurocognitive. I say by age 6, we're now knowing that these are not reversible. So if your child is 6 and they're hypoxic, their brain is not going to heal from this. So I'm really trying to pivot, and it's not about the teeth. I could care less about the teeth. I mean, you develop the face, develop the airway. The teeth have space. I don't care about them, but I want the brain healthy. And that's really what we should be focusing on, is that from that angle. And that's completely different, obviously, than what orthodontics and dentistry, just generally, we're not taught anything about the brain. So.
So, and that comes down to, people are going to like, why are we not taught it? What's your reason? Why do you think you went to amazing academias, right? A great dental school, right? You top notch, all your classes. I'm asking a question. I know you weren't taught this in school. Why are they not teaching it? Why do you think they're scared?
Well, it's easy to to stay in your comfort zone, right? I mean, Sagi always says, half of what you learned is going to be outdated within 5 to 10 years. And honestly, from a dental perspective, everything I learned in dental school, I stopped doing within 5 years. Like everything was not like the techniques were, everything was archaic that was being taught. And even though there's part-time clinical, like affiliate faculty that are in the undergrad dental and in all those specialty clinics, you're relying on those people to be at the top of the field, to be bringing in like the latest, because you have academics and then you have the real world, but then you have the envelope pushers. And at least orthodontically speaking, there's just, their brains are siloed and dogmatic. And I don't mean to poop on it at all. And
No,
that's why.
listen, I've been open to say is that I've realized, so you asked where I'm living. And so
Oh,
I'm
yeah.
I'm living in Louisiana.
Oh.
Yeah. I came down here because a doctor that I started consulting with from Zagi, right? He was coming out all the time, taking all the courses, and a couple different docs. All of a sudden, I ended up with like 3 big clients in the South,
Okay.
one in Mississippi, one here, and one in Alabama. And it was tail ends of COVID. So 2022, I think 2021, 22. I had some big changes happen in Vegas. Me and Tara Urson from SmartMouth separated. We went our separate ways, which I talk very clearly. I have no regrets. Every single person that was in my life was absolutely meant to be. And when I tell you what I learned from that position was that I was never meant to work, like be in a practice with somebody. I was always meant to help get people to shine, get them to where they needed to be, and then let them go. And the truth is I overstayed my welcome. Like I didn't have an exit strategy, and that was on me. And then, I wanted to start teaching ortho and airway. Like I wanted to start doing the myo and ortho stuff. And, Breathe Institute wasn't ready for me to do that. And I one thing led to her. I mean, we're still, me and Zagi, everyone's great. I did my last, actually so funny that I did my last lecture for TBI. We had just moved. We had moved here. I didn't even tell anybody. That's why no one even knew. I didn't tell anybody. I had this opportunity down here. He was building a pediatric sleep center. He said he was going to build this big pediatric sleep center, wanted me to come down and spearhead it. It seemed like it was one door was closing, another one was opening. My mom's in Florida. COVID did, I'm from New Jersey. Barry was where I learned. And we did recognize that we really were far from our family on the East Coast. These were all the things we were telling ourselves, but it was all meant to be. I came here. I was already working with that doctor for a year, and I got here 3 months and it ended. And it was absolutely like a car crash, but it actually is what led me to go down to Costa Rica to do this, to do plant medicine. And lately, TBI is like, hey, we're doing an online lecture that we were still doing online at the time. And they said, you're going to lecture. And I said, I got a lecture on Saturday. I flew to Costa Rica a day early because I was going into the retreat on Sunday. And there was no words ever spoken. I got on, I was in this hut, like in this little hotel in this hut in Costa Rica. And I did my lecture. And I remember closing the computer. And I kind of almost knew that was like, that I had just closed there was never a word. I mean, till this day, there was never a conversation about it. I went in and I did my first retreat, and actually came out of that. I hadn't talked to Sarah because when I left Vegas, I actually drove to Sarah's house in
Arizona.
Phoenix, in Arizona. I left before we moved. I drove from Vegas to her house. I called her up. I said, I need to come see you. I had to practice in Vegas. I called her and I said, so I drove to her house and I said, I'm going to stop practicing. I'm going to go do this big thing in Louisiana. I'm going to give faceology I want you to just merge it all together. I don't care. I don't want anything. I'm going to just, and she looked at me. She's like, all right. I moved there 9 months later. I text her, I hadn't really seen her. I'm in that retreat and she comes to me in this very big thing and I call her. And the next thing I know, she's the first person I end up talking to, and a couple other things happened and major changes in her life. She decided to get, she met somebody very like, I felt like I went into Costa Rica. She was one. And then she came out and she's like, I'm getting married. I'm like, okay. And pivot, change. She's like, I need you to take over faceology. I can't do it. And I had just that whole other situation landed. So one thing, it was this perfect shift, one door closed, and it's actually everything happened exactly the way it went. And it really allowed me to get back and focus on doing therapy, like doing it in a new way with a new component, with a new mindset. And these last 4 years, I think if you can even see how I mean, it's been a pretty big evolution. You can see it very much. And it's been beautiful. And I finally feel really confident that I actually just did a solo episode before this. And I said, I didn't realize that unlocking myself was becoming the most vulnerable and most authentic version of myself, and just saying, this is who I am. If you don't like it, if it's not your cup of tea, then I'm okay with it. And I respect you and I love you and I wish you well. And just truly leading with gratitude, right? Like every aspect. You couldn't recreate your story, my story, if you tried, right? Like you couldn't bottle that up and sell it. It's what makes, I think, people like you or myself or Sarah or Zarush. You can't recreate that. That happened. Those things happen because it's meant to happen. And I believe it's so that we can, unravel and move. Jeff Rouse. I mean, we could go on and on about some of these people that have absolutely Dr. David. I mean, what is the stuff he's doing? I mean, all of a sudden I'm like, that podcast came out of nowhere, blowing things up. I mean, now I said, I've never, he makes it look so cool. Which actually was one of the big things. I used to tell patients, you are absolutely a surgery candidate, but honestly, you probably don't want to do surgery. Like that's what I would, because I was working with Dr. Reza, Dr. Reza Movahed was doing great stuff. And I worked with a bunch of great patients in him, but it was a uphill battle. And we were doing pre and post up. We were doing all the right things, but it was nothing. It didn't feel cool or stuff. I don't know. It felt like a battle. And I feel like what I'm seeing with this technology and this movement, and I'm sure Rez is doing it too. I haven't spoken. I've spoke to him last year, but when I saw that you had done it, which when you chose this, I was like, wait a minute, Kimberly did jaw surgery? And I'm like, I thought she was in MARPE. I thought she was in, right? I was like, wait a minute. And I'm like, oh, wait a minute. I want to know what's going on here, because the evolution of your story, I want to know. So, just to get a little clear, so we said you did AGA, you did MARPE, you did those.
So I started with the DNA. So I was a Vivos provider for a hot minute. And then I guess I'm still one because I paid all the money, but PC moment. Anybody who wants to DM me about, just let me know. So I put a DNA in and I couldn't last 5 minutes. I don't like lots of big things in my mouth is what I've really come to
realize.
I have big tori. I don't know. That's why I didn't do very well, I think, with the mandibular advancement.
Well, do you think that maybe there was also the fact that you felt slightly claustrophobic in some of them and that you didn't have a lot of space and, that was very intrusive to your mouth?
Yeah.
And being intrusive for a very long period of time, you're talking putting yourself in a restrictive, whatever it may be, and all that bulkiness for 12 to 13 hours a day it's
a long time. Yeah.
It's a lot. It's a lot to ask of one person.
Well, I did fine with the AGA. So I had the cemented, I don't know what the proper name of it is, the restorative device. So I had one. I had it put in literally the night before I was flying to Audrey Yoon's MARPE class. Maybe, I think it was. And then COVID shut down 2 weeks later. And everything was moving along. And then the mechanism got bent, so I had to take it out and I put a new one in. And then I started getting headaches. And then I took
Mhm.
my first MSc class or MARPE class or my second one, I guess, obviously, because I had Audrey. And I'm like, I want one of those. so, so I took the agate out and then put, I'm trying to remember. This is where I was going with the MSE is we were stuck with 4 TADs. And
Okay.
what we know now is that we need bigger screws than the MSE screw, meaning the midline screw of the MARPE. So I only use power screws. And for adults, you need at least 6 TADs, if not 8. And my belief, and there's different gurus that talk about everything has to be para-midline, nothing lateral. I do think if you're going for 6 TADs, you need at least 4 midline and 2 lateral. And it all
Okay.
depends on the bone. So you have to,
Yeah.
everything's developed
So
custom.
now, so setting up, so it's not that you feel, so your MARPE was
Failed.
not failed, but you have agreed and admitted that you felt as though it wasn't treatment planned properly.
We didn't know any differently. It was
Okay.
2021 and partners didn't exist. And we didn't know.
And Partners is the lab, just for anyone listening,
Sorry,
right?
thank you. Yeah,
Yep.
Partners Dental. And I've been using them for, yeah, I don't know, I think since
Do you
21.
use Partners for even your pedo expanders as well, like for all your 3D?
Yes,
Okay.
yes. And I was working so I'm now doing some new TAD first MARPEs. So it's the benefit system. So you place the TADs, then you scan. The MARPE is a superstructure, and then you screw the MARPE to the TADs, and then you can swap out parts. And the MARPE is not sitting on the tissue, so you get 0 tissue impingement. I'm
Okay.
playing with it. We're doing
Yeah.
all sorts of.
But your treatment planning very different from learning
Oh,
what didn't work in your own mouth.
absolutely. And if you don't learn from, not mistakes necessarily, but if you don't learn from, there's always a learning,
Curve.
there's
Yeah.
always a message in every case. And how do I do that better and differently? But in my own case, we did cortical punctures and 4 TADs, and it was an MSE. And so,
Cortical punctures, for anyone that's not in the medical, it's when we put when we actually want to go into the bone, you actually put
poke holes.
little
Yep.
bevel. What's the proper word?
It's like you're poking hole, like you're puncturing the cortex of bone, corticotomy.
Yes.
I'm
Which
sorry.
allows the
Cortical
bone,
puncture.
which allows it to actually move easier and then fill it, correct?
You're trying to stimulate the wrap effect. So you're inducing a trauma or inflammation so that you get more cellular activity so that the suture, and weakening the suture also.
Mm-hmm.
So punctures are little like pokes in the bone. Now we do piezo. And so I do full on cuts, corticotomies, anterior nasal spine, and then across the palate. Depends on the age of the patient. And if it's usually males or older females, all males like 20-ish and up, females like if we're in the 50s and up, just as a belt and suspenders. But I haven't had to resort to dome cuts yet, which is really good. And dome cuts, everyone, is where you're doing Lefort. You're doing bigger cuts to help release the suture.
Yeah, you're doing cuts like up on the upper maxilla bone onto the
And
side.
then
That fun stuff.
pterygomaxillary.
Mm.
But what my mentors like Dr. Lipkin and I don't know, everybody's my mentor. But if we're doing
You are
cuts,
pretty close with Dr. Lipkin, right? Like Dr. Lipkin and
yeah,
you, he's kind of you and him have done a lot of stuff together. And guys, Dr. Lipkin's in New Jersey,
yep.
and he's been doing MSc for a very long time.
Oh my
Correct?
gosh. I think he's probably done the most. And him and Richard Ting are actually ortho buddies. They went to school together. So they kind of have a very healthy, cute,
And
like
remind me again, where's Richard Ting? Is he in
Richard
California?
is in Orange County,
Orange County.
California.
Yeah.
Yeah.
Did he buy Dr. Bill Hangs?
No, that was a different fellow.
Oh, okay. A different one.
I
Okay.
don't remember, but I believe he's doing MARPEs now too.
Yeah. He's also doing MARPEs.
And then I'm friendly with everybody. I'm a very collaborative human.
Yes, of course.
But I'm going to study with Jeremy Manuele. And
I know Jeremy. So I know Jeremy very well because, well, me and Jeremy's from Vegas, but not even that. Jeremy went to LSU. So he also went to LSU, but here's the craziest thing. Do you know that Jeremy is the one that brought Nora? The story is right. Like Jeremy Manuele was Nora's attending. She went to UNLV for pedo residency.
Oh my gosh.
And he because Tara Urson was very like, would see him and we would all kind of play around. And he went down and took a myobrace course down in Rancho Cucamonga, and he brought Nora and all of them. And I think that's where she reconnected with Zarush. And I think after that was history. I think they knew each other prior, but I think there's so it's like, that's how small the Airway world is. Yeah. And I had actually went over his practice, Hamilton and Manueli in Vegas, very, very premier practice. They're excellent.
Yeah.
And I'll never forget, Jeremy he would send over, and he said to me that I needed to get a little bit more dialed in and a little bit more stylish in my myo, because if he was referring patients, it needed to be very, very high functioning. But I now recognize that it was because how meticulous he is and how he treatment plans and sets things up. He needed all of his collaborators to be on that exact plane. So again, learning a lot from many people and super excited. And I'm very hopeful that because he's an LSU grad and the things he's doing, I know I'm down here because I can stir things up and do things in a way. And I think I did it from New Jersey. I did it when I was in Vegas, and I think I'm down here to keep the motion going. My kids are fabulous, doing wonderful here. The family culture here is fabulous, but LSU is a religion here. I mean, they all, it's proud. They love it. It's a great atmosphere. And I think we need more LSU grads to help teach and move things. So love him. I'm so excited that you're taking his course. And please tell him I said hi.
Yeah, I know him we're on WhatsApp together, and Claudia Pinter, I was with her in Austria. That's everywhere. It's like incestuous.
Everywhere, yeah.
I'm all over.
So now you're doing that, but now let's because I know the listeners are like, okay, get to it. I know you went to Houston. You took Dr. Alfie's course, right? Is that what it was? Or he was lecturing?
Yep. He was. So Todd Shire, he's an amazing periodontist. He works with Alfie. So I met, Todd hosts Beyond Perio Ortho Limits, which is, it's surgical ortho, it's MARPE, it's SFOT. And I've now taken it 3 times. I can't get enough with just one time. So the first time I took it, it was during COVID, and David didn't even talk. He was just there in the audience. And I'm like, he's got some cool cowboy boots on. And so I went over and met with him, and I was like, oh, it was just a little light conversation. And then went back to B-Pole, I think because Mariana was talking, and Audrey.
Dr. Mariana Evans.
And I love learning, but you can always learn something every time. That's why I go back and I go back and I go back, because I'm doing my experimentation, if you will, in my practice, and these others are as well. So, and then I collaborate. I have a very close group of colleagues, Lupi Roca. I don't know if you know Lupi, and Shannon, and Lena Sapoznikov, and Joel D'Souza. So we have our own little family, and you
have your group. So you go down and you're listening. So you meet with them, and then
he shows, then he lectures, and I was just like, oh my gosh. And the fact that he can get double jaw surgery done in under an hour, which means that your post-op healing is much more optimal. And then I asked him, what insurance do you take? Do you take any? And he took my insurance. So I was like, okay. So
you had Blue Cross.
Mm-hmm.
Because that's the only insurance you take.
I know. So I was just like, okay. But in hindsight, and I've told him this, we text all the time about patients or whatever, if I have questions. I really wish I would have done a MARPE first, because my nose is still constricted.
Oh, because you didn't do a ton of ortho before or after.
Zero ortho before.
Yeah. Okay. So you would have done MARPE. Oh, so that's okay. I'm really happy I'm talking to you about this.
This is what
yeah. So, okay. So you wish you would have, even though MSc, let's everybody understand MSc, the difference of MSc and MARPE, what would have been the difference there?
So MARPE is kind of like Kleenex and tissue. So MARPE is what we refer to as the expander itself, or a skeletal expander. And the R is actually it's now being called MAPE, because we don't do rapid anymore. Or MASP for slow palatal expansion. But when I use the word MARPE, it's like the appliance, meaning it's implanted in the palate. It's going to give us true skeletal distraction and expansion, not skeletal dental. And so the goal is developing the nose. So any other appliance, and I feel like I can say this and wholeheartedly say this, that only a MARPE fully develops the nasal floor.
Mm.
So an AGA does not, a DNA does not.
So
A
what you're pretty much saying, if you are narrow in the upper maxilla and you are having any roof of mouth issues where you have any narrow, high voltage palate whatsoever, anything like that, the only like true structural situation that really you need to be doing is MARPing.
yes,
And doing that with ideally with a person that knows how to use 3D printing, knows
absolutely.
all the tools, knows all those aspects. And that's the best way to go about it.
And that really truly needs to be a consideration before jaw surgery because
Before
you
jaw surgery.
cannot get
Maxilla expansion like that without just doing the jaw surgery, because Lafort surgeries are a little bit opening but moving more things forward
yep.
than it is doing any of the width expansion as
And
much.
if you do a three-piece, so I was talking about this with Claudia Pinter, and I think Renata was there when we were in Vienna. The key to optimizing nasal resistance is the anterior part of the nose, the valves.
The valves, yep.
If you're doing a three-piece, you're not getting anything in the anterior. So
Mm-hmm.
the claims that you're getting the same outcome with a three-piece and the same volume, maybe, but you're not changing the resistance. So you have to, does
Oh,
that
so
make
you
sense
have
now?
to
You
mm,
have to use a MARPE in order to get the anterior dimension change.
because the MARPE is with because of the suture, because it's changing.
Yep.
Yeah,
Yeah.
it's
So a
expanding the suture.
Sarpy, like a Sarpy where you're cut, there's so much we're going to talk, but yeah,
Yeah,
a
yeah, but I know what
Sarpy
you're saying.
is,
So because of
yep,
the cuts on that.
yep.
So when you go in, just for this, and because I know we could talk for hours, but when you go in and you do the surgery, so you choose to have the surgery, your healing was pretty quick. I mean, from a double jaw surgery, healing wise, and you are because you did have diagnosis of sleep apnea.
Mhm. I did.
So here's, I guess, a question. So sleep apnea, we're pretty confident jaw surgery can make and change that. If you're suffering with sleep apnea and you want to get off a CPAP, double jaw surgery, go see Dr. Alfie. He could probably make a big difference there.
MARPE first.
MARPE first, even okay.
Because then if you don't fix the, and I was talking about this with Dr. Yusefian,
Yeah,
he's amazing. So I want to bring him into the fold with you at some point if you'd like.
I'd love
But
to.
it's the nose. You have to develop the nose first.
First. Okay.
And Bill Hang was on the meeting this morning and all he talks about is sagittal. And I get it. I know. But if you don't have a nose that's functional, you're screwed.
Yeah, you don't. Well, that's the same thing, even with like, that's why all prefabricated appliances fail. If you can't breathe, you can't keep anything in your mouth. So, I
No,
mean,
no.
it's always been about the breath. The whole reason everything starts is because of breathing.
Mhm.
The breath is everything. It is like, I always talk about, like, you think about like as if there was like a secret emerald or, a stone hidden that kept the whole world functioning. And, you lose it. It's the breath. Without the breath, we have
Mhm.
nothing. And so you
Mhm.
have to protect and develop the breath at all costs, like, because your body is going to fight and it's going to create compensations at all costs the
Oh,
other way
yeah.
if you're not getting optimal breath. So 100% on that. But now, what you would say, right? So sleep apnea, feeling better. You're not on a CPAP anymore, or are
No,
you?
I'm not. I'm not.
Okay.
But I have it's interesting. I have this weakness in my like I can't keep like I have good tongue, I have good suction, but there's some weakness in my muscles. Like I can't keep my jaw
Mm,
shut.
you
So
can't. Okay.
I have to tape to keep it
Closed.
closed.
I know you were struggling with your myo there for a little bit. Have you been
Oh,
better with it?
nope.
Well, when you're ready, I'm here to do it with you. I think you'd be
Ooh.
very impressed with the new stuff that we're doing.
I like, I have all this. Oh, I have so much other cool stuff. I haven't even talked about the, oh my gosh, my
It's
daughter.
okay. Let me bring you on this one last piece and then we're going to kind of wrap it up. Tell me, if somebody is struggling with UARS, are you do you think jaw surgery, or do you think they should still be going MARP? Like if they're struggling clenching, that
Yeah.
that tight bite, clenching, grinding, where they can breathe through their nose, but ultimately, and they can even get their tongue up, but they are struggling with,
Mhm.
smaller, the still cocktail straw stuff.
No, I think, well, I just bought a four-phase rhino manometer. So
Okay.
we are starting to implement it next week, I think, or the week after. So that will tell us if there's nasal resistance. So I fully believe upper air resistance, there's a nose problem.
Even though you think we still can, even if it feels like you can breathe through your nose, there's something going on with the breath. Pretty much
Well,
just
because
reconfirming what I just said.
yes, sorry, I answered. Yes, no, I
No, no,
think
no, but almost answer like I answered my own question by asking the
exactly.
question.
Because upper air resistance, so if you're closed and there's resistance, that's going to create the vacuum that causes the tissue to collapse.
Mhm.
So I think that's why intake strips are great, because it's opening, it's getting less, it's more passive. So I
Yeah.
think patients think they can breathe through their nose, but they don't understand that they have resistance.
Oh,
So I think that's why having all these diagnostics to know and be more precise in our treatment planning. But I do think I think MARPE is one of the biggest gifts that
okay.
Dr. Moon developed, or maybe somebody else did around the same time.
Well,
But
Dr. Made, I think so. You are, which I love this, is that you've gone through multiple and you are saying still that MARPE
oh my gosh,
is we can't discredit it. And ideally, everyone that is struggling with UARS or sleep apnea or OMDs or breathing issues or some fatigue can probably benefit from doing MARPE.
absolutely,
That's
absolutely,
huge. That's
and
that's huge news.
it's and then so the lower arch, though, this is the other thing. The lower arch determines how much expansion you can do on the upper.
Mm.
So you can decompensate. So most, if I don't know who follows your podcast, but so if you have a narrow maxilla, you're going to have generally the mandible is actually the right width, but the teeth are tipped in. That's called they're compensated.
Maxilla is the criminal,
Oh,
lower jaw is the victim.
yes, yes. Unless you're in class 3, then the
Then it's
victim.
the other way around, right? Yeah, then we're yeah.
So how much expansion, and this is where myself and my colleague, my good friends, we precisely know how much expansion we need based off of how much the teeth are tipped in. So
Mhm.
if I want to open up the nasal floor 8 millimeters, but I don't have that on the bottom, then I have to treatment plan SFOT.
Okay.
Or I have to start thinking, and this is where this is not fully out in the world just yet so much. But I think Reza, and then I know Dr. Yusefian does this. He does a distraction cut and then
Okay.
expands the mandible.
So you got to expand. So you might need lower expansion as well to be able to get the most out of the MARPE.
Yep.
Wow.
So it depends.
It
It
does.
just
So
depends.
what we're recognizing, and I think where we could go, and like you said, we could talk about it for hours, is that we have come a very long way. You need to continue. And maybe what I'm learning from this is that I'll be up in your area. We're doing a live course. Maybe I need to come see you
What are
and
you
we need to
doing?
do a full workup. We're doing an in-person Myo mentor up
Where?
in Seattle.
When?
In Seattle. I'll send you the dates. I'll get them over to
Ah,
you. But
because you'll have to come try all my new stuff. I didn't even
I'll
tell
come up and maybe
I
I need to do a full workup with you first.
I have a neuroplasticity magnet,
Oh my god.
transcranial magnetic
That
stimulation.
is well, amazing.
I have
Well,
talk to
I
me. Shop.
we'll need to get together on those things.
I know.
Well, I again cannot thank you enough for coming on and chatting and going down all these rabbit holes. And again, we will do a part 2. I'd love to do some bonus content with you for my ortho myo stuff so we
Yeah.
can go deeper into the appliances. But we have a little thing we do here at the end of the podcast is that I ask everybody when you first think of mind your mouth, what's the first thing that comes to your mind?
About you or
No,
about
just the word, mind your mouth. What does it mean to you?
Good question, lady. Critical thinking on Saturday. I mean, initially it was okay. We need to pay attention that we're keeping our tongue elevated and our lips sealed with passive oral musculature. Was really
Where your mind went,
that was where my mind went. Yeah.
which is exactly where it's supposed to be. You're
Oh,
supposed to go with your first gut, which shows that you are a true airway dentist in and out. And when you first think about your mouth and you think about it, you think lips closed, tongue up, and breathe through your nose. Well, Dr. Kimberly, I can't thank you enough. I appreciate you joining me this afternoon, and I can't wait to talk to you soon. Thanks so much.